wife, mother, Previvor, Girl Scout leader, employee. Previvor, it's pretty much a new term. It's someone that has prophylactically gone through surgery to prevent the onset of cancer. So I'm BRCA1 positive, which basically means that I have a gene mutation on my BRCA1, and it causes me to have an 85% or greater chance of getting breast cancer over a lifetime, and a 45% chance of getting ovarian cancer over a lifetime. My family has had a lot of breast cancer, and basically they found the BRCA1 because my uncle on my mother's side has 5 daughters, and 3 of them at young ages started to be diagnosed with breast cancer. And so they're like, there's got to be a connection. And at that time, it was the late 90s, early 2000s, and they really weren't doing a lot with genetics. And so naturally they thought, okay, it's coming from the mother's side. Well, that wasn't the case. So they tested my aunt and she was negative. And they tested my uncle, and sure enough, he was positive. And so when they went and they looked back, they looked at my grandmother. She, young age, she was in her early 40s when she was diagnosed with breast cancer. She had a bilateral mastectomy. I mean, and you're talking the 50s. You know, she had the bilateral mastectomy, and she ended up passing away from breast cancer. Then it kind of went to the rest of the family, and my Aunt Judy, my mom's sister, was diagnosed with breast cancer. She was in her late 50s. She ended up passing away from complications from breast cancer. And so my mom was tested. She was positive. Knowledge is power. I want to know. You have to be the one to make the choice. So I went for the genetic counseling, and they went through the whole gamut of, this is what this means. Do you really want to know? And I did. I really wanted to know. And I remember sitting there when the results came back thinking, say negative, say negative. And she, of course, said positive. I'm going to put it to the back because I really can't deal with this. I'm too young to deal with this. It's not happening. I'm just not going to think about it. But then trying to get mammograms. They didn't want to do them. You're 25 years old. Why are you getting a mammogram? Why are you having testing? I was denied for life insurance because of it. So, all of these things that you have to deal with now that you know. But for me, this was the choice. And I had little kids at the time, and I want to see them graduate, and I want to be a part of their lives. And I don't want to hear the words, you have breast cancer. I don't want to hear it. So, for me, I took a while. I found out I was BRCA1 positive when I was 25, and I took about 4 years, and on my 29 was when I had my surgery. So I went into it. My mother said, you're so calm. And I said, well, I've prayed about it, and I've really taken the time and made this choice my own choice for reasons that were my own. They weren't anybody else's. I didn't do it for a cause. I didn't do it because I'm trying to be someone. I did it because this is the best option for me and my family. So I ended up having a bilateral mastectomy with a TRAM-Flap reconstruction, which is basically they took my stomach tissue and they moved it, which is such a huge surgery. They basically take you apart. You have a scar hip to hip, and they take everything up and they cut all your muscles. And so, then they do it all at once too. It's not like they do the mastectomy, they put in an expander and you go back and, you have it filled. This is a 12-hour surgery and you're in it for the long haul. It was big. When I came out of surgery, I looked at the clock and it was 5 o'clock, and I had remembered rolling into the surgery and it was around 8 a.m. And, I didn't remember much. And then I do remember looking at that, and then I got up to ICU because it was 4 days in ICU. I was just covered with all this equipment, and it was kind of scary because there were a lot of people in there, and I really wasn't sure what was going on, and I really wanted to see myself. But at that time, they had something inserted into my stomach, a pain blocker, and so that was in there. And then they were checking the pulses, because you have to check to make sure that you've got pulses are there, because they had to reconnect a bunch of things. It was a little bit overwhelming. This is the beauty of being a Previvor and being able to make your decision and say, okay, I am not going to go through that. I'm not going to have it. Although I may have other sicknesses in my life, this is one I can prevent. I feel so bad for the women that don't have that option. My two before, and both being girls, they were really the reason why I did this. I wanted to see them grow up, graduate, get married, but we're still so young and we weren't done having a family. So after the surgery, we decided to have Olivia. And I'd gone from the TRAM-Flap, you have this nice flat stomach, and it was great. And then I had a baby, and now my stomach will never be flat because it always pushes out. It is what it is. But it was funny because when I had her, and you wouldn't think you would have been able to feel anything. I was tender, and I'm like, the body's such a funny thing, it remembers, it's not breast tissue, but my body knows something's supposed to be happening. I couldn't nurse, obviously. It was a different experience, and in some ways kind of sad. But again, I had made my choice, and I was fine with it. Then we had Emma. Emma was a surprise, and now I just live my life. I don't think about it on a day-to-day basis. I go yearly for my testing, and it's all good. My doctors wanted it much earlier, but again, I wasn't ready to give up on my family. So when I was 36, just after I had my last baby, I had a hysterectomy. And I think it was a little too close to when I had my baby, because they said not everything had gone back to the normal size. So it was really difficult. I'd gone from these pregnancy hormones, and then all of a sudden I had a hysterectomy, and now I'm thrown into menopause. So it was like overload hormones to absolutely nothing. So I really had a hard time. Mentally, I had a hard time. Physically, I had a hard time. I really, I can't take any hormones because BRCA is hormone driven too. So they don't want to increase your chances. So I couldn't have any replacements, but I'm doing good. Yeah, much better. Barely a woman. No boobs. There's nothing inside. Classify me as you will. I don't know. I don't really think about femininity. I don't think about it. I think I just think about me. My womanhood is defined by the children I brought into this world and the love that I share with my husband. I don't think of myself any other way. So I don't know how to define it. I don't know as I could. Sometimes I don't feel feminine. Sometimes I'm just trying to make it through the day. When I get dressed up and we go out, I like to feel pretty, and I guess that's when my femininity comes in. But other than that, I'm just surviving. I really think that you need to soul search. You need to find a doctor. If you choose not to get tested and you have a strong family history, or someone in your family has been diagnosed with the BRCA mutation, at least go to find a doctor and get monitored. That is the most important thing. You have to take care of yourself, and you have to know yourself. So if you're not the type to want to know the test, at least do yourself the favor and have them monitoring. It is life-altering, and it is big, and you really need to be able to take that in and have someone walk through it with you so you understand the ramifications. I just thought this was such a wonderful project. It really was taking something that we see all the time, and you see these women walking down the street and you wouldn't know what their private struggles are. And this really allows you to put the struggle with the woman and to say, okay, this woman has done it, and this is what she went through. And although every day you see this beautiful face and she's conquering her daily struggles, she's already gone through this, and this is her private struggle, and it's really just bringing the two together. It's such a dynamic and raw thing. I thought, I have to be a part of it, and I bring a different perspective, so I thought, even better.